Hi, I'm Matt Bubala here with another Fountain Report conversation. Today we're joined by Dr. Jeffrey Bloomberg. He is the founder of Veterinary Diagnostic Centers. Thank you so much for being with us, Dr. Bloomberg.
Thank you for having me.
All right, so let's talk about Veterinary Diagnostic Centers. About 2 years now since you started this. Tell me the concept.
So the concept was, as a referring veterinarian, I was always having trouble getting ultrasounds done for my patients. The two options were always mobile sonography coming in or sending them to the specialty center. And both of them had major drawbacks. When a mobile sonographer comes in, first of all, it's tough to get the scheduling, the three-way scheduling between the sonographer, the receptionist. Can the person bring the dog in that day? Then the dog has to get dropped off. You don't know when the sonographer is exactly coming in, and it was a frustrating, disruptive process to our practice, but we did it because the animal needed that service, and it was the best way to provide it for them. Then there's the specialty hospitals, which, can be a little bit chaotic. They're intimidating to a lot of pet owners. If you talk to pet owners, that whole process of going into the big specialty centers with that massive waiting room full of animals, when they have their own sick animal that they're worried about, you talk to pet owners about that experience, and they're very worried about going there. And so I said to myself, I think there's a better way to provide the service. And so our tagline actually is redefining the veterinary ultrasound experience. And so it's a very personalized situation. The pet owner stays with the pet. That they can get in with us the same day, next day. The reports are read by a specialist, so it's really high quality medicine. I attribute, COVID really accelerated the acceptance of telemedicine. Sure. I think that has really helped us. I'm not sure if we would be as well off as we are if COVID didn't happen, interestingly enough. Utilizing telemedicine basically and trained sonographers and trained support staff in veterinary medicine, we're able to connect referring veterinarians with specialist guidance. And I really like the term specialist guidance because specialists are not taking over this case. They are helping the referring veterinarian know what to do next. They're providing additional information to help guide that referring veterinarian. And I think that's another great thing. Anything that can do to help primary care veterinarians retain their cases and maintain that client-patient doctor bond, I think is very important for job satisfaction, for client satisfaction, and I think is best for the profession.
So it's great for you because you've got clients coming in because they're not going to be able to get this done as quickly or as easily by their veterinarian or getting into a specialist to have it done. And great, I imagine, for the referring practice because it's building this relationship. They just made life easier for their client.
Right. And
you're bringing them back to them.
Right. The clients, by definition, if you're getting an ultrasound, you're worried. Ultrasounds are not wellness care. So if your veterinarian has told you need to go for an echocardiogram, you need to go for an abdominal ultrasound, by definition, you're worried. And so the situation we have where the pet owner stays with the pet, when I talk to them and when they have to drop off their pet for an ultrasound somewhere, it's nerve-wracking for them. They're not told exactly how long it's going to be, sometimes 3 hours, 5 hours. They're just waiting for a phone call when their pet's ultrasound has been done. And you really hear the tension in their voice when they're telling you their experiences. And I love being another option. I love filling that void. There's certainly a place for mobile ultrasound. We're certainly not as great as the specialty centers in so many ways. There's a niche we're filling. We're filling a void there. We're not appropriate for every situation. If you have a bulldog and congestive heart failure, don't send them to us for that echocardiogram. That should be, at the specialty hospital. If you have a splenic tumor that you think may have already ruptured and is bleeding in the abdomen, we're not the right place. So there's a time and place for us. We fill a void, and we're happy to step in and do that for people.
So you like looking at where you're solution-oriented then. You
Sure.
stepped back, took a look at what needs to be filled, and you did that. What do you see down the road? I know you're continuing with your veterinary diagnostic centers, plan on opening, I imagine, many more.
Correct.
But what are other needs in the veterinary space as you step back and look at, here's things we need to do over the next 5 years to help pets get better care, better access to care, pet parents have an easier time doing it. That's one of the things you're solving right now is relieving some of the stress of not being able to get into certain places or get things done. What are other areas that you look at that you say, we've got to do a better job, we've got to figure out how to crack this?
I think, I know that AI is the flavor of the month here. I think 2025 in veterinary medicine is going to be the year of AI, right?
Mm-hmm.
But I think there's a reason for that, because because we have a lack of veterinarians, anything that you can do to free up a veterinarian's time to do what only a veterinarian can do, prognose, diagnose, and treat. That's what a veterinarian should be doing with their time. So anything that you can delegate to support staff, anything you could have technology take care of for you and allow a veterinarian to do what only a veterinarian can do, I think is critical for our profession. I think that's one of the big, big things. And just finding unique, innovative ways to improve access to care, right? If you can't free up a doctor's time, how do you use telemedicine to shrink that wait time to get specialist input and to do some advanced diagnostics? I think those are two really, really big trends that need to be continued.
Dr. Jeffrey Bloomberg, Veterinary Diagnostic Centers, thank you so much for being with us.